Namaskar, friends. I am Deeptisharma Joshi from Global Healthcare. We are running a show that is Global Health Medi Talk Show on California TV Live. And today in the studio, we are having with us Dr. Renuka Gupta. Dr. Renuka Gupta is an eminent gynae oncosurgeon from SHREE AGGRASEN Hospital, Delhi. She is also a practicing gynae oncologist surgeon in Segal Neo Hospital, and ma'am is also practicing as an oncosurgeon in Jaipur Golden Hospital. Welcome, Dr. Renuka, in the studio. Namaskar.
Thank you, Dr. Deepti, for inviting me on this renowned occasion of World Health Day.
Actually, as we all know, tomorrow is a World Health Day, and in that series, we are initiating this program with Dr. Renuka Gupta. Because she's a world-renowned doctor in the field of oncosurgery, gynae oncosurgery. She has done a lot of work at the community level, in the hospital level, and in the academic institute level. So I want to ask, my first question goes to you, Dr. Renuka, that what are the common gynecological cancer?
So, first of all, I want to let you know that gynae cancers are related to the reproductive organs. Okay, gynae is basically related to the female. So, female gynae cancers are basically the cancers of ovaries, uterus, fallopian tubes, cervix, vulva, vagina. So, these are the basic reproductive organs, which can be cancerous. So nowadays, because of change in our lifestyles, the cancers are very common. We all know that incidence of cancers are increasing. So most common cancer, even after the so much awareness in India, is cervical cancer in rural population and the endometrial cancer in a urban population. So we are dealing with so many cases of cervical cancer, even in the eras of vaccination and screening. So common cancers are the cervical. Breast cancer is also a very common cancer, but usually dealt with by the surgeons and oncosurgeons. So I am dealing mainly with the endometrial cancers, uterus cancers, and ovarian cancers, which females are usually suffering.
Yes, Dr. Renuka, very nicely you have told me about the type of the gynecological cancer. I just want to know the differentiation between the cervical cancer and endometrial cancer.
So, if you know about the different parts of our uterus mouth is basically the cervix. It is the cervix which is a part of uterus, and the endometrium is the lining of our uterus. So, when the cancer of a lining, uterine lining is there, it was causes endometrial cancer, and when the cancer involved the mouth of the uterus, that is called cervix, it is called the cervical cancer. So endometrial cancer ko we are calling uterine cancers also, and cervical cancer is basically known as cervical cancer, which is caused basically by an infection, while the endometrial cancer is basically caused because of a hormonal disbalance. So cervical cancer is a completely curable and preventable disease.
Yes, doctor, I just want to understand that which type of patients with ovarian cancer can be diagnosed in the later stage.
So, if I'll talk about the ovarian cancer, it is a very notorious kind of cancer, I must say, because in ovarian cancer is a wide group in which we involve the peritoneal cancers also, as well as the fallopian tube cancers also. So, what happened initially, ovary, there is a cyst in a abdomen which cannot be maybe diagnosed, but usually patient having a symptoms of gastritis. In ovarian cancers, ascites is there, that means a fullness in abdomen with a fluid. So patient usually having a symptoms of gastritis, frequent symptoms of gastritis, that is bloating after eating, infrequent, she has a frequent indigestion, they're not able to digest the food completely, having a bloating after eating, or usually they have a confusion that we are having a gastritis, and they usually meet with a gastroenterologist frequently and taking antacids, painkillers, and they are ignoring their symptoms as a it's a very common habit of taking the eno, right? Digestion, pantocetes. So they usually ignore their symptoms of gastritis, and later on, when they underwent the ultrasound, it was noted that hey, they were having a huge distension of abdomen. Abdomen is full of disease as well as the ascites. So that is why the ovarian cancer is usually misleading and misdiagnosed and diagnosed in later stages. So if we are suffering from a problems of gastritis very frequently, that means if you are having a symptoms of gastritis at least 3 times in a month, definitely you should go for the ultrasound just to diagnose. Maybe you have a ovarian kind of cancers which can be diagnosed early. So not, you should not avoid your symptoms. Your symptoms speak something, so let's listen these symptoms and get your investigation properly. Because ovarian cancer usually diagnosed in 3C stage. At that time, in this stage, we have to give the chemotherapy first to the patient after diagnosis, and then we have to do the surgery. Otherwise, if they'll diagnose in a initial stages, even only with the surgery, we can treat these kind of patients.
Very nicely, Dr. Renuka, you have told me about the ovarian cancer. Now, I just want to understand that as a doctor, what are the screening techniques or what are the procedures as a doctor you do on your patient to diagnose cancer?
So, if overall cancer is concerned, cancer is a very big term because in body, in each and every part of our body can convert into cancer. So, if we'll talk about the screening, most important part of screening is oral cavity, because over in oral cavity, if we are having any kind of ulcer which is non-healing, so we should seek towards a doctor, because non-healing ulcers are usually common cancers which can be diagnosed early. In cases of gynae cancers, we'll talk about cervical cancer screening is very important, because we know that cervical cancer is caused by the human papilloma virus, which is type 16 and 18 virus, which can be diagnosed with a simple meaning of test, that is pap smear and HPV testing, which is available, which is effective. And cervical cancer is having a pre-cancerous stage, because whenever we need a effective screening, we need a pre-cancerous stage or a stage early stage which can be treated and cured. So for the screening purposes for the cervical cancer, we use a cervical cancer screening with HPV and pap smear, which is very basic OPD testing. There's no need of any anesthesia, no need of any fasting. They just take scraping from the cervical mouth of the cervix, and these cells are automated processed into the lab, and it tells that any changes over the cervical cells is happened or not. If any changes are there, we can treat the situation then and there, and we can prevent the proceedings of the cancerous formation. Okay, it is so cervical cancer is very screening is very effective, and it should be done in each and every ladies after age of 21 if she is sexually active. If she is not sexually active, in India we are not taking the pap smears, but after the sexual activity, after the age of 21 years, every 3 yearly if we are doing pap smear, and every 5 yearly if you are doing to co testing, means HPV testing only, it can detect your risk of next 5 years to 3 to 5 years about that you are having a risk of development of cancers or not. So cervical cancer is very effective. Likewise, mammography for the breast is very effective screening modality, because mammography can detect the small calcification years before the development of a lump. Because whenever we are having a palpable lump, it should be at least 1 to 2 centimeters, but at that time the cancer is usually spread stage is usually comparatively more. If we are detecting the small calcification, that's the microcalcification in the mammography, so we can detect the cancer in even the in situ stage also. So, or in a cases where we can just operate the situation and can get cured with it. So mammogram and cervical cancer screening are the two effective screening for the cancers. Other screenings, likewise for ovarian, for the endometrium, these screening are not as much effective as cervical screening, but still the patients who are at risk of the cervical cancer, or risk of the endometrial or ovarian cancer, like that some patient having a family history of a cancer, some patient having a history of Lynch syndrome, BRCA positive. You all know the Angelina Jolie fix, we all must be aware about. So BRCA positivity, these patients are very high risk. So in these patients, we start even the ovarian or breast screening at the very early stage. We are not waiting till the age of 40. We just start the screening 10 years before the index. Means in family, if patient is having a cancer at the age of 10, 40, we start screening at age of 30 years. So what we have to do in screening for the breast screening, it's very simple measure: self breast examination. Self breast examination, that female has to check her breast regularly at the monthly interval after her periods over. So with the help of her flat of hands, she can just palpate the whole breast in clockwise or anti-clockwise manner. Complete breast should be palpable in front of the mirror. And then lastly, she has to press her nipple to see any kind of discharge is there. Her nipple is retracted. Her any changes in the nipple uh, retraction, inverted nipple is there. Any changes in their breast skin. So these changes, if she notice, she should consult with a uh, either with a gynecologist or gynae-oncologist or a surgeon, who is ever available near her. And then she can undergo the either ultrasound or the mammogram or directed biopsies if any lump is there, if any visible lesion is there. So self breast examination, the clinical breast examination, and then the ultrasound and mammogram. These are screening for the breast cancer. So effective screening are for these patients. And in patient with family history, we are doing the regular ultrasounds of abdomen for detection of the ovarian cancers also. In patient who are having a Lynch syndrome, we advise even the colonoscopies to identify the colon cancers also. So these are the effective screening programs.
Yes, Dr. Renuka, we know that you are a specialist in laparoscopic surgeries, hysteroscopic surgeries, then you are also performing radical cancer surgeries, ovarian cancer surgeries, uterus cancer surgeries, cervical cancer surgeries, and vulva cancer surgeries. Beside this, one very interesting surgery I came to know about you, that you are doing fertility sparing cervical surgeries. These days,
Yes.
as we know, because of the sedentary lifestyle, people are facing lot of infertility problems, and to diagnose infertility they are generally going to the gynecologist and performing some endometrial studies, uh, or some like ultrasounds, and some specialized x-rays they are performing. So I just want to understand, what is this fertility sparing cervical surgery that you are doing in your specialty?
So basically, Phil, I'll elaborate the fertility sparing surgery, because we all know, as you mentioned, that said because of sedentary lifestyle, we have a very modification in our marriage lifestyle also, because females are getting married at a delayed age, then they want to conceive at even later stage after the marriage. So what we are facing because of changes in lifestyle also, we are getting cancer in early age. So cancers are diagnosed in early age and patients are getting married at later age. So when they diagnosed with the cancers, they have not completed their family. So it is very important to spare the fertility spare. It means we have to, if you know that whenever we are doing the reproductive cancer surgeries, these are the usually radical surgery in which we are removing the uterus, the ovaries, the tubes, as well as we are removing the lymph nodes, pelvic and para-aortic lymph nodes. So these, if we are removing the complete ovaries, so how they can be fertile, how they can conceive if we are removing the uterus. So some fertility sparing surgeries we are doing for the cancers. So if I'll talk especially about the cervical cancer, in cervical cancers, the disease are limited to the cervix, and we are if we are removing a part of cervix only, and we are remaining the uterus and ovaries are there, so fertility preservation procedures can be done. So if the stage is very early, that is only the stage 1A, and there is no LVSI, the patient cannot understand these things, but we have to make them understand about this, because they have a fear of cancer recurrence and all. So we have to make them understand that we are removing just your cervix, part of the cervix, or the cervix in a form of radical trachelectomy, and we are doing the complete oncological clearance for you. We are not we are saving your uterus, your ovaries, but we are removing the complete cancerous part, and we are doing complete staging also. So it will give you better results but preserve your fertility in case of cervical cancer. Even in cases of endometrial cancers, if the disease is diagnosed very early, it is limited to the endometrium, we can start some medications to them. So these are in high doses, but these medications can cause the cure of cancers. But even in a ovarian cancers, in a germ cell tumors, very germ cell tumors usually involve very young girls. So in these patients also, we usually preserve their ovaries. We are removing the affected ovary. We are preserving the second ovary for the future fertility. So in these patients, we have to counsel the patient that we are doing surgeries for your fertility preservation. In cases of older age group, in a cervical cancer, in a patient with the borderline ovarian cancers, we usually tell them that these are uh, the procedures so that you can obtain your fertility, optimize your family, but these are not the curative surgeries. So whenever you completed your family, you can undergo a further procedure after you're completing your family. But definitely procedures are available, but needs awareness. Even in a patient where we have to do the radical surgeries, we can preserve their ovarian tissues, or we can preserve their oocytes. We can make, because in an era of IVF, we can even make the embryos and preserve their embryos for the future transplantation. So even in a uterine transplantation nowadays is available. So we can offer the patient various type of fertility preservation options for the cancer. So but it need awareness towards the patient, because we have to change the psyches also, that definitely, even if you are having a cancer, you can become a mother, you can undergo some procedures which can not be life threatening for you, and your uterus can be saved.
Thank you, Dr. Renuka, for telling us in details about the treatments that you are doing for fertility, sparing cancer surgeries, cervical cancer surgeries. Now, I just want to know that what is palliative treatments that you are doing in your oncology practice?
So, if we'll talk about the palliative treatment means we are not doing the cure of the patient. So, palliative treatment means we are doing just symptomatic treatment. Usually, palliative treatment is given to the patient who are having a stage 4, in which, or up, even not the stage 4, but in patient where we cannot give the they cannot take the proper treatment because of their multiple comorbidities, in these patients, usually in a stage 4, we are giving there the symptomatic management. Like a patient with endometrial cancer, if she came in early stage, we can give her a complete cure with the removal of uterus, doing complete staging surgeries, and if needed, they will radiation and all. But if they come with a stage 4, we are starting the treatment with the chemotherapy. It is called as a palliative treatment, not the curative treatment, because we want that patient is get palliation, she get be symptomatically relief, CR will be there, but chances of recurrence are quite higher whenever we are treating the higher stage patients. So we want the disease either become completely cured or remain stable, but sometimes patient is having a extremely bleeding. So at that time, I know that removal of uterus cannot give cure to this patient, but we have to remove the uterus just to palliate the symptom. That if she is heavily bleeding, what can I do for her? So I have to do either the surgery or give high doses of radiation to the uterus just to do her free from that bleeding part. So that was kind of palliative kind of surgery. Sometimes patient with the CS cervix are coming with a retention of urine because disease is completely over the vagina, over the vulva. So in these patients, we have to catheterize the patient or give the suprapubic cystectomy. So these are the palliative kind of treatment. Like if a patient is having a severe hydronephrosis and we have to do the stenting. So these are called the palliative treatment. Means we are giving palliation, that is symptomatic relief to the patient according to her stage of the disease. We're not getting
That
she is
means,
not getting.
Dr. Renuka, the patients who are into metastasis,
Yeah,
the
that
patients who
is
are into the
the stage 4.
metastasis and their disease has agrified, they have come for one disease and then they have diagnosed with a different disease. In oncology,
No,
there
that
you
is,
have started giving
they
people.
came they came with the disease, but that is metastasized to the complete body, you can say. That means the brain mets
Okay.
is there, bony mets is there, so we cannot treat the complete. If disease is limited to organ, we can treat in like an ovarian cancer. If disease is limited to the abdomen, we can operate easily, but disease is going to the chest, going to the brain, we cannot operate in these kind of patients. So we have to give the palliative treatments to these patients. So palliative chemotherapy or surgical, all kind of palliative treatments we are giving just to do her symptomatic relief in metastatic cases, definitely.
Yeah, Dr. Renuka, my next question goes to you that what is the importance of understanding the family history of the patient and what is the rationale of genetic testing in the cancer patient?
So, family history, I already told you, like in a BRCA, Lynch syndrome. So, the various, if I'll talk about the family history, and so some patients are, when they were diagnosed with a cancer, they just wanted to know that it is related to my kids also. My kids will getting these cancers or not. And for us, it is important because we just wanted to know her risk stratification. So, like in a BRCA patients, if we are dealing with the ovarian cancers or the breast cancers, so usually 5 to 10% cases are familial cancers if we'll see the overall. But if a patient is BRCA positive, her risk increases. By the age of 70, her risk is around 40 to 50% of getting the breast cancer or the ovarian cancers. Even the breast cancer is much higher side. So if we'll know the family history, because whenever a patient came with any symptoms, we take family history to know the risk, because we have to stratify her treatment. So what should be offered to her? Like, so it is important for this kind. Even in a treatment, the family history also important, because in a patient with the ovary or breast, whenever we are doing the BRCA or HRD testing, it will help even in a adjuvant maintenance therapy. Okay, so nowadays the PARP inhibitors are very good drugs are coming up. So in which we are giving in a maintenance therapy. So which can even give the prolonged PFS. Means their disease-free survival are more. So these drugs can be started in patient with BRCA positive. The family history also important for the next generation also. Like if a patient is diagnosed with cancer, if she is positive for BRCA, so we can offer the BRCA testing for her daughters, for her sisters, so that we can offer them the risk reducing surgeries. Risk reducing surgeries means that the surgeries which can reduce the risk for developing cancer to her. Like if my patient is BRCA positive and her daughter came to me that my I also want to know my status, so I'll get, if she's positive then her daughter is also BRCA positive, I can offer her risk reducing bilateral salpingo-oophorectomy for to remove so in which we are removing her tubes and ovaries if she has completed her family. So usually in BRCA1 patient, we are removing these risk reducing surgeries are done usually after the age of 35. So we can counsel that you should complete your family over time and then underwent the risk reducing surgery. This even the removal of the ovaries can reduce the risk of breast cancer in these patients also. And sometimes if patients have completed her family and they want the prophylactic mastectomy, we can also offer them prophylactic bilateral mastectomy to these patients because they are having a very high risk of uh, breast and ovarian cancers. So in patient with Lynch syndrome, we can offer them the hysterectomy or continuous screening, yearly screening with the DNC. So we have to offer them these kind of surgeries so that they can reduce the risk in future.
Thank you, Dr. Renuka. You have given us a very strong knowledge regarding the oncology, the gynae oncology, what cancers are all about. And now let us take a personal preview of yours because you are a very simplified and a uh, very new woman entrepreneur, I must say, because you have got a different angle to see the world. Your aspirations are very high, whether in terms of doctorate professional or being a social worker also. These days, I have seen you at multiple places in Delhi NCR where you are giving the lectures for on the women's for the cancer prevention, like guiding them how to do their breast screenings, giving them an immense knowledge that they should talk about their disease because the people who are staying in the periphery NCR region, they are afraid in talking about their disease. And recently, you have become a consultant for the Punjab Kesari uh, uh, adult group for senior citizens. Punjab Kesari Nagarik group also you have joined and adopted few villages in Delhi NCR region, whether it is Gurugram, whether it is Narela, or whether it is Sonipat, and you have given consent to give them free. Uh, Medical OPD screening to them and giving them a subsidized rates in the terms of treatment in your respectable hospitals wherever you are going. So, right from the beginning, I'm seeing you are doing something other than other doctors because you are very busy doctors and involved in three big major hospitals of Delhi. And despite that fact, you go into the community and give your cancer lectures for treatment, prevention, eradication, and also for palliative care. So, what things has inculcated you as a social worker and a doctor to promote all this?
Exactly. I'll tell you that when I came after my training for the cancers, when I start my OPDs, when I start even in a very educated people, they don't know about the screening. They don't know about the vaccination which is available for them. They don't know how to treat. Usually, even in a very higher educated people, they're very rich people are came with a severe advanced disease. Then I came and thought that if the situation is like these kind of peoples are like this, then what about the poor peoples? So they are so definitely shy in nature. They don't tell because gynae is kind of organs that cannot speak clearly with their childrens also because usually the oncology is for the elderlies, if I can commonly says that breast cancers because they are very shy. So I try to create the awareness that these are the problems. You should speak about these. Okay, and if I'll give you consultation, you are free to come to me and give my consultations, my opinions, and I'm giving you the best care. Definitely other doctors are also giving the best care to them, but you have to tell about your symptoms. You should be aware about your symptoms so that you can at least go and take treatment on time. Because even you, if you see the death data in India now, so death rates of with the cancers are very high. The patient even going to the government hospitals, I must say that government hospitals are so much busy, so much burdened that they are having a lines in a days and a months, and they are not getting the treatment proper on time, because they're not they're not getting in even their numbers in OPDs. So that's why I'll try that I'll go even a village or some slum areas, so that they can at least come. They should know their problems and at least can be treated. So I'll try to subsidize even the treatment for them, so that at least they can afford the treatment. I cannot offer them completely free treatment, because the hospitals are usually private, but at least whatever I can do for them, I'll usually try to do that. At least my try that patient should be cancer free. Like in a cervical cancer, it we can cure the cervical cancer with the vaccination. So India, in one era, India has developed the cervical cancer vaccines, and it is they'll try to make it cheaper and cheaper, so it's available, and only the two doses, even a single dose works. So if we are giving a single dose to our girls at the age of 9 to 14, it can prevent your most burdened cancers in India. So it can be preventable. You should go for the vaccination. And definitely I'll help out. If anyone wants a vaccination, they can contact me. I'll try whatever way possible I can do for them, I'll do. So this is my
Yeah,
only
Dr. Renuka, one thing we can do with you, if you permit us, that we will make your 7 7 minute series of this gynecological cancers like breast cancer, one series of
yeah, sure.
5 to 7 minutes, where you will be giving an education with the PDF and with your
Sure.
communication. And those CDs we will show in the remote areas, in different places where these type of events are going on, because
Definitely.
everywhere, because you are very busy doctor, and time is very difficult for you, so we
Yeah,
can have those series. I think you should make 7 series with us on
yeah,
cancer: one for ovarian cancer, one for breast cancer, one for cervical cancer, one for the treatments, various treatments of cancer as a whole, the genetic therapy what you are giving, and the type of treatments you are providing in
yeah,
cancers, so that we can develop these snapshots of you in terms of a small series, and
yeah,
we can
definitely. You
educate
should.
in the people in masses.
Definitely. Education is must. Cancer awareness is must. Because if you know the symptom, then only you will show the symptoms.
Yeah,
Otherwise, you will
you can show the
usually.
picturization of the treatments that you are doing, the type of surgeries you are doing, because once the patient will see them, they will be more cautious, because anytime they got some symptom, they will immediately go to the doctor.
Definitely. So I'll
And
definitely
last
make a.
question, Dr. Renuka, of mine. You have received many prizes, awards, accolades at national, international. Your paper have been presented at international level as well as in Indian domestic level, and also you are a member of GYNAE, Foxy Federation, GYNAE Onco Cervical Cancers Organization, endoscopic organizations of IMA, DMA, and many other. So just you tell me which all organizations you are associated with, and what are your success parameters, what are the big awards and accolades you have got in your field.
So basically, the awards are many, but these awards are just for the working with many of your people. So these are basically the Global Healthcare Awards, which I'll get for get in a by the Top Notch Foundation. And the government of India also awarded me with the Rashtriya Ekta Puraskar, and some Gynec Forum also give me the APJ Abdul Kalam Awards, just for serving you people. And I'm your doctor, I'm your daughter or friend or whatever you can think. So these are your love and affection only. So what I get, then I'll definitely try that. I'll serve the people till I die.
Thank you so much. Thank you so much, Dr. Renuka. Thank you for coming in the
Thank you.
studio and sparing your valuable time. All the best
Thank
for
you.
your future journey. Thank you.
Thank you. Thank you, Dipti. Thank you, audience. Thank you.
Thank you.